A major news story in Britain this week is that the National Health Service is 70 years old. Before I continue, on a personal note, whenever I or any member of my family has needed health care, the NHS has always delivered. We've always got the treatment we wanted within a reasonable time frame. But not everybody is so lucky. It has been suggested in the press this week, or at least claimed rather suggested, that the NHS was set up to replace a system which was lacking. I'm not sure that's true. Some years back, I was talking to an old man and asked him straight out what was wrong with healthcare in this country before the NHS. And without hesitation, he said nothing. What does that prove? Maybe nothing. Maybe he was born into a rich family who could afford private hospital bills. But maybe not. But what I do know is this. The commonly held belief that a Labour government in the late 1940s created a great cradle-to-grave healthcare system where none existed before is a fiction. What happened was hospitals existed and a government nationalised them. Just as they nationalised the coal mines and the railways. Nobody ever argues that the Labour government in the late 1940s created a coal mining industry when none existed before. Nobody ever suggests they created a railway industry when none existed before. They nationalised what already existed. So why do we persist with this belief that a healthcare system was created? It wasn't. It was nationalised. But then it wasn't just one system, it was different systems. We had private hospitals, much as we understand them today, where you pay for treatment as and when you receive it. There were subscription hospitals where you would pay a subscription, a fee every month, and then in the event of needing hospital treatment, you would either get it free of charge or pay a reduced fee because of your monthly payments. And there were also charity hospitals. So there wasn't one system, but there was a good collection of systems on the whole, which delivered healthcare to the nation. And I'm not prepared to say the NHS is better because, for example, I can remember when on the front page of one of the national newspapers that a woman who had cancer needed surgery, but kept putting back the date of her surgery because of various pressures, and eventually her cancer became inoperable. These things happen. But no government, as far as I'm aware, has ever told us how many people in Britain each year die of diseases they contracted in NHS hospitals. Wonder why not? The healthcare system in this country is a near monopoly because most of us are paying so much in taxes plus other bills such as cost of living. Cost of having a house can be quite expensive depending on where you live in Britain, that most of us cannot afford to pay private hospital bills. So if you need hospital treatment and the NHS provides what you need, fine. But if the NHS will not provide what you need, then you're in a bad situation because most people in Britain cannot afford private hospital bills. Or at least not very often. And that is why I am not prepared to say that the NHS is a better system than what existed in this country before. I'm not saying it's bad, I'm sure it has much in its favour, but it is a system which often lets us down. It's never let me down, it's never let any of my family down, but it often lets people down, and to suggest it is necessarily a better system than what existed before is probably wrong. But it is a fiction that is maintained because people can get away with it. And will continue to do so, because let's face it, the very small number of people are left alive nowadays who can remember healthcare in this country before the NHS, they won't be alive much longer, will they?